Good afternoon, guys. My name is Dr. Larissa Mila from Vista Clinic, Australia, and today we are discussing commonly asked questions about threads. Lifting threads, tightening threads, collagen stimulator. There's so many different types, so many of our patients just lost. So what it is, how to distinguish, and pros and cons of each of them. So threads can be divided into two big groups. The first group is a permanent threads. That's what we used to have for a very long time. That's a threads which will never dissolve. It's just a material, synthetic usually material, which is standing there for very long time. It's still used, but very carefully. The reason why, because when you have a thread inside your body thinks this is not our genetic material. This is foreign body, and I will try to protect my body against this intruder. So how our body protect ourselves? With a scar tissue or with a fibrotic tissue. And it start to build a capsule around this, trying to encapsulate and make it kind of inactive, not really doing much, kind of completely closed and covered with its own scar tissue. And that's good because it's also give us additional volume, it can give us additional collagen stimulation, but also it's bad because scar tissue form you volume in the places which you can't predict. And it also can give too much scar tissue or too little scar tissue, and it can be lumpy scar tissue. As you can imagine, these kind of threads we rarely use, and it should be with a lot of care. What very good technique, Dr. Denis Guadeau from France. He's using permanent threads for more than 10 years. It's a main specialty of his practice, and I've been in his trainings and few in Los Angeles and in Paris, and he keep on using me with his results. So what he is doing, he's going through the scalp, through pretty much quite tight structure of the scalp, and just under the skin of the scalp, he is moving. His thread is moving all over to the tissues of the face, where he, in a strongly attached fixation point, pretty much stitch the threads, and then using this kind of stitching point, they pull back. It's similar to, do you remember this movie, My Big Greek Wedding, when the two ladies tell to each other, okay, I do like this, tied up your hair, you tied up my hair. And in a photograph, they tied up each other's hair. And if you tie the hair, you can see like a little lifting going on. So that's pretty much the idea of the threads. That was brilliant idea, really. So additionally, this kind of lumpiness and this kind of scar tissue provide you a bit of volume under your hair. As you know, as we age, we lose bone volume. Everywhere in the face, in our body, in our scalp, and that's why additional volume in the upper part of your scalp is actually looking quite beautiful. It will give you additional kind of volume in the head, which give you overall younger appearance. Plus, because this technique does not go actual soft superficial tissues of the face, we are not in the risk of formation of this tricky parts of the lumpiness later, or like tethering inside dimples, or all other kind of things which we used to have in the past, but really don't want it anymore. It doesn't stop aging, and we still age. And what we do usually with these permanent threads, when person age and things are still dropping down, patient come back every 2-3 years, it depends on your age, and doctor opening this kind of knot point under your scalp here where the threads are knotted, tighten it up a bit more, stitch it again, closed, voila. This is a permanent threads. I personally very rarely do this. The reason why, because it's not as strong in my hands. It's very minimum results. When you kind of try to pull like this, it gives you a little bit of nicer look, but it's not that much difference, and it's not as easy to actually have it, so to stay like this. So in my hands, for some reason, it's not as strong, and majority of doctors, they don't use it either. maybe it's a future thing when we use it more, because we'll have much more experience and protocols and knowledge of anatomy, but at the moment it's still very few doctors can do this. The big area which most doctors use are absorbable threads. If how to explain what it is, you have to imagine if you cut something, like cut your hand, and you come to doctor and they make a stitch of your wound. So when they stitch your wound, they can use two different types of threads. Either it can be synthetic absorbable, either it can be synthetic non-absorbable. So non-absorbable threads, it's when doctors stitch your wound and you have to come back in 7 to 10 days and they take it off. This is very commonly used in medicine, but for cosmetic medicine probably it's not as much, because when I insert under your skin something and lift it, patients don't want to come back, find the thread. Of course, non-absorbable give you a bit better quality of life and less time to come back. So that's why most of the things we talk about will be absorbable. A lot of different materials. It's a big family and group of different materials. If we talk about absorbable threads most commonly used, at the moment it's two. It's polylactic acid and it's PDO. None of these materials are new. We've been using them in medicine for many years. For cardio surgery, for blood vessel stitching and muscle stitching, etc. So it's quite well researched, quite safe materials, and they very slowly absorb within approximately 6-8 months or so. The positive side effect of these threads is collagen production. It's quite nicely stimulating your own collagen. That's why a lot of patients notice that it's a little bit additional lift later on a superficial layer of your skin, as well as skin quality improvement. The skin just become more glowing. Usually they notice it much more with polylactic acid. It's a type of threads which has like a lactic acid, like a milky acid, which is given additional revitalization effect, glowing, whitening, lightening, much stronger collagen stimulation effect. They're also more expensive, as it usually happens, and both of them can be different types inside them. So you probably heard about mono threads, and you probably heard about barbed or cog threads. So mono threads, what it is and why we use it and why it's completely different from any cog threads. So skin. This is skin. When we get aged, we have the superficial layer of the skin, like this one, thinner. It's also because it's less elastic, and because it has less collagen, it's much more easily breakable, but do not restore easily after it's broken. So that's physically look like when this layer is thin and breakable. Each time you move, you smile, your eyes are smiling, you make a frown. There are a lot of different things that you can do, or even here things are slowly drooping down. They cause like a breakage of your skin, or sometimes it's before like a proper breakage, which is a wrinkle. We can have like a wave of the skin. When the younger skin is thicker and more flat. As we older, it's more wavy, it's not as even, it has sometimes breakages, which we call wrinkles. So that's where mono threads come to help. They're like a mesh for the skin. We insert the mono thread, which is like a thread, like a normal thread which you use for stitching. It's shiny, it's very smooth, nothing there. And we insert with a little needle this mono thread just inside the skin, in a layer which gives support. Also in a layer which give us like a very nice production of the collagen, and where it's pretty much grow, because skin is grown from inside. There are most of the blood vessels and nerves, and then this kind of basal layer cells, they become more dry, more kind of thin, and they slowly go to the top. The top layer is like a shield, and it's actually dead cells. That's why we use peelings and scrubs and all laser different modalities to kind of make it like all this rubbish out of the skin, like a snake, kind of take it off, so the new skin will grow better, the skin will be more glowing, it look nicer, and all this kind of pigmentation rubbish will be also peeled off. So if we'll put this collagen stimulation thread in the upper layer, in a dead skin, it's not going to be much effect. So that's why we're going a little bit deeper. A little bit deeper, we also have, this is actually hair follicle. That's why quite commonly people notice that their hair grow better. For this reason, monothreads sometimes being used in a female pattern or some mild cases of male pattern hair loss, particularly in this area, in the occipital frontal area, or sometimes with age we lose our eyebrows, especially in a lateral pattern. We just insert the threads under so we can support collagen and metabolism of this part of the hair follicle. It's also regenerating general skin, so we kill two birds with one shot. We create like a mesh, like a carcass and support, so skin is not folded anymore. And the second, we stimulate collagen, we stimulate this blood supply and general well-being, and kind of things are moving in. So this is what monothreads are. You have to be really clear, monothreads is not lifting. Monothreads is not giving you V-shape. It's, or like thread, like, you know, this foxy eyes kind of eye thread. It's not. It's only acting within the skin layer. So it makes skin thicker, it makes skin more glowing, it makes skin better, it makes your hair follicles to grow better and all other structures to function better, but it's just for skin tightening, really, for skin quality improvement. The other types of the threads, they are very different. They are actually giving you more lifting effect. Being very precise, we have to be careful what we call lift, because a true lift can be only done with a surgery. We age on the different layers, like a pie, like an apple pie, you know, it's a different layers, and that's how we age. We age in the skin, we age in the underskin fat, in the muscle, in a bone which is being resorbed, all these layers being resorbed, and that's how we age. And if we only do skin tightening with the best lasers, with the best RF, with the best biorevitalization, on whatever we do, it's only skin. But also layers below also age, then we would benefit from having more comprehensive approach. The next layer just under skin is called fat pads or superficial fat. We can lift, or I could rather say reposition up where it came from, because it's quite mobile. You can actually try to play yourself. If you try to like play with different fat pads on your face, the most common and the biggest kind of fat pad, which is not as attached, it's this which we all hate, but we all have it really as soon as a human. I'm sure you will have a little droop in the mid face, because the fat pad, which is going from here, slowly it going to your nasolabial fold, then process produced a little bit on your jaws. Some people it happen earlier, some people happen later, but this is a normal process of how we all really get in there. And it's not about age when you need to lift this part up. It's not about the age. It's about your particular situation. Because passport age and biological age are very different things. And when your biological age is clearly there, when your mom was like that, when it's like your age type, when you just by deformity things are dropping down, but you think, okay, I'm 35, it's too early to start this, so I'm not going to do this, although it's clearly there, like then you come to doctor when you're really advanced, and doctor will say to you, look, I can't do much now, it's too much falling down, or the only thing I can do is to give a referral to plastic surgeon who will actually lift things up in all layers. So it's much better to come when you have actual problem than to wait a certain age or to certain whatever. Look at what you have, listen to your body. So what threads do, they, with the special hooks, let me show you these hooks. It's a lot of different types of hooks, by the way. It's a whole classification of different types of threads and different manufacturers. Each of them believe they're the best. They have different shapes of hooks and different direction of the hooks and thickness and other characteristics, but I'm not sure if you can see it very well. This is like a little hooks in the thread, and the thread is usually quite long. So these hooks having like a fish hook effect when you insert it and push up all these kind of fat pads, but they can't come back easily because of these hooks and because of the fixation point where it's all pretty much attached and where it's very tight. So that's how it works. The thread lift, how it's done, we use like a needle, just a normal needle, similar to what we do with filler or Botox. Just needle is slightly bigger, approximately the same with the lift, sometimes with a filler. In this kind of tight area, which is called fixation point, we do like a needle prick. Sometimes we use a little bit of anesthetic before, sometimes don't, depends on patient how they can tolerate pain. And we do a needle prick. After we've done the needle prick, we have the cannula. It's a blunt cannula. It's like a piece of plastic some sort. It's blunt. It has no needles. It's dull, so it can't really cut things. And inside of the thread, inside of this cannula, we have a thread. So what we do, like then this kind of blunt cannula through this needle prick go inside, just under the skin, and introduce the thread, and then we take cannula off, but thread is left there. The whole process, as you can imagine, prick, insert, taking out, not quite long. It's actually quite straightforward process. If doctor knows, of course, it's been tried well and don't know exactly which fat compartment they want to enhance. After that, doctor just do a little bit like this. Some patients, they have a lot of thread left and we can reinsert it somewhere else, like to give support here, you know, like we have not much volume here, to give additional support. It's also, as you can see, like lifting the neck and giving the jawline a bit more straight line. Quite commonly, doctor gives 3 threads. It goes one to nasolabial and bring it back where it came from here. Then the second come here to jaws and bring it here too, and then the third one is here. It's actually enhancing both of these, and it kind of gives like a lift here of the neck, of the jaw angle and the jawline. And these 3 threads, pretty much after you've done them, staying there. It's no cuts, it's no like stitches on the top or dressing materials. It's actually quite safe. Sometimes we can have bruise. Not from the threads as much. From threads it's very, very rare because they're not really needle or cutting material. It's mostly from the needle prick here, like any other areas of the face. Wherever you put a needle, it's always chance to get a bit of blood vessels, little bruise. Sometimes it's little, sometimes bigger, but it's always can bruise here. Otherwise, in terms of side effects, it can be infection. Infection also can be with any procedure, and it's probably one of the worst things which can happen is infection, because if you don't come to doctor early and we don't start antibiotics, that will lead to us, like we have to cut this cut, actually make a little cut, and doctor with a special hook just take the thread out. Thanks God, it's extremely rare. I personally never had infection with a thread lift. Let me touch the wood, and I will hope to keep it this way. I have a very, very high standards of sterility. It's probably much higher than we need to do, like by law, but I really don't want to have complications. That's why I would try to be on this kind of extreme part of too much hygiene and don't have infections. Then after we've done it, patients pretty much can see effects straight away. But there are 2 buts. We always do overcorrection. The reason why, because after this initial procedure of the lift, it's always gonna slightly drop back. And for some effect to still stay there, we actually pull too much up. Like one of my patients said, there is no such thing like too much pull, but it is actually, because when it's too much pull, you can see sometimes dimples, you can see sometimes it's kind of too much puckering of all the skin here. It has its cons, and it easily can be usually hidden. Just put your hair on it, or just to stay at home over weekend. Majority of these overcorrection things are gone within few hours or 2 days, but in some rare cases it can be lasting up to 2 weeks. It's never more than 2 weeks, but 2 weeks is a really long time, like we consider, to have like these little dimples. The layer where we work, as I mentioned, this is only superficial. We just go above the muscles, above these nerves, dangerous blood vessels. That's why it's quite safe. If you look at the skin is pretty much on the top, then we have subcutaneous layer, and then we have a fat pads, like a pillow under the skin. And this pillow under the skin we actually correct, which you can actually easily palpate yourself. If you will try to pinch this area, that's pretty much what we will reposition. We don't reposition like on a bone or smash like deep layers. And if you will try to do this movement yourself, and it's actually improvement, that means threads will work for you. If there is no improvement, in this case thread is not good for you, because the skin and superficial fat easily reposition with your movement of your hands. This procedure, what I've just done, they're the most commonly used, because most commonly we have these patch problems, which lasting better, have good results, very minimum side effects. And the only thing which I change is type of threads. If someone has more advanced prolapse down, or if someone has a very heavy skin here, or if someone has very thin skin with a lot of skin, a lot of kind of dullness, and it's kind of not really metabolically active, you can say it, that's when we prefer to use polylactic acid. I like them a lot. They give this glowing of the skin becomes thicker, more moisture, more lighter. They also create stronger collagen, and because they're usually thicker, they have a quite nice, very nice lifting effect. They're more expensive. I think it's almost twice more expensive, or 1.5 times more expensive, but they're definitely stronger. Regarding so this is threads, different types of threads. It's about to say what we can do together with the thread lift procedure. There are three more commonly procedures which I normally use. The first is fat dissolve injection, permanent fat dissolve injection. Some girls have very heavy fat here on the chin, and thread is kind of pulling up, so less weight, higher we can pull, and less and longer it will last. But if it's too much kind of hanging down, if you try to pull up, result will be not as good and will not last as long. Also, if it's too much fat which reposition as a natural filler to the cheeks, it might look weird. That's why quite commonly for these girls I just do as a first stage fat dissolve injection here, and then when fat is gone, we can do like excess skin and a little bit of other fat pads, just to lift up here. The second commonly associated procedure is actually botulinum toxin or muscle relaxant. What it achieves, there are muscles on the lower face which are pulling down. It's actually quite a lot of them. It's platysma. Platysma, it's a muscle which pulling down your jawline towards the neck. The muscles which are pulling down here, the angles of your mouth. The masseters which help you to chew, but also it's pulling down this part of the face and give it bigger and kind of very strongly pull threads as well. So we can first of all relax all these muscles, and then we can bring up with the threads all this material, all these tissues. This combination works better because when we pull up, then this reposition tissues pretty much heal here. You know, like when you come with a cut, when you had a cut and doctor stitch, then they took off the thread, but the tissues actually together. And exactly the same how it works with threads. We pull it up, we leave here for a while, and tissues kind of grow kind of here. So that's why when the thread is gone, you still have nice kind of effect here. And clearly it can grow to a high level if you relax all this kind of tissue, all these pulling down muscles. And number 3 procedure, which is commonly quite good associated with the thread, is dermal filler. Dermal filler is hyaluronic acid based, most commonly used, which is a natural moisturizer, and it lasts from 1 to 3 years according to our research. So why we use it? Because when we age, we lose bone, and when bone is gone, that's when things start to droop down. If this part we can reposition with the thread nicely, central part is not. It's quite commonly to like a lost bone kind of depression points here just outside your nose. It sometimes can be under eyes as well, just here we're losing bone, that's why things start to droop down. It also can be lost bone excuse me, on the cheeks and here in the mandible area when you don't have very nice angles, or when your chin is not big enough. So to do this kind of tweaks of lost bone in the right places, we can just replace it with a natural filler, which is quite commonly used for these purposes. That also give you more fresh, more rejuvenated effect. So this pretty much, I think, comprehensive discussion about thread lift, what we use it with, and what kind of threads. Summarizing, we have mono threads for skin tightening. We have lifting threads with the cogs for repositioning up the tissues. And we have also different materials, more stronger polylactic acid and not as strong PDO. We also use quite commonly like adjunction procedures to maximize effect, which can be fat dissolve to kind of make it not as heavy, filler to replace the bone which is gone, or muscle relaxant to relax muscles which are pulling down. So hope you enjoyed it, hope it was helpful, and if you need more information, we have it in vistaclinic.com.au. Please visit, it's quite a few photographs as well of actual patients and videos, how procedures are done, and please feel free to ask questions and come to our clinic. You're more than welcome. That's our clinic, by the way. Have a great day, guys, and see you soon. Cheers, bye.